All right, Georgina, thank you for coming to interview for this nursing position.
Yeah, my pleasure.
All right, so when are you going to be graduating?
May 2018.
May of 2018. Okay. How many years will it take you to graduate?
Total it'd be 5. So I did 2 years of prerequisites at LSU in Baton Rouge, and then LSU's nursing school is a 3-year program. So total of 5.
All right, perfect. Thank you.
Mm-hmm.
Can you just tell me a little bit about yourself?
Sure. So school-wise, I'm a very dedicated student. I love what I study. I've always been a science person. I've always loved, my science subjects, and I've gotten it really well. So I'm very focused when it comes to schoolwork, and I put a lot of time and effort into studying. And then socially, I love spending time with my friends. I'm a very social person. I'm a huge people person. And yeah, I kind of just apply working hard and also balancing enjoying myself to all areas of my life. So
cool. All right. What does your ideal job look like?
My ideal job would be to work somewhere that is flexible when it comes to helping each other out. So having coworkers help you out when when you have 8 patients, or when you have maybe 4 patients, but one really serious one, and just being flexible with helping one another out. Definitely involves being sociable with people, being involved with people. That's why I chose nursing. It's one of the reasons why I chose nursing. So yeah, I think those are the main components. Just having a team feel within my coworker environment. Just knowing that you can count on them and they can count on you, and we can be there to help each other out.
Absolutely, that's perfect. So why do you want to work for this specific company?
Well, I've heard a lot about, I've heard a lot of good things about the hospital, and I like the benefits they all offer. I love the floor that I'm applying for, and I don't know, I've heard a lot of great things. I love the facility. It's a beautiful facility, and I just think it'd be a really nice fit.
Good. Can you describe how you handle tight deadlines on the job?
Tight deadline. I guess putting that into an example, a tight deadline would be if a patient needed a medicine right now, stat, and you had 5 other things going on. A way you can manage that is prioritizing and almost delegating what you can and can't do. So being smart about your decisions, saying these 2 things are top priority. I need to do this first, and while the other stuff might be important, you can't get to that first. So you need to decide whether or not that can be put off, or you need to ask someone else for help and say, look, I have this going on. These 3 things are important, but I just can't get to them first. So could you help me out? And just communicating, and that's a huge part of nursing, is communicating and delegating and prioritizing.
Right. Okay, so what are your 2 greatest strengths and 2 greatest weaknesses?
I would say my 2 greatest strengths are, let's see, I'm very hardworking, and very dedicated. And then I'm also very compassionate and empathetic. And actually, I know it sounds kind of cliche. I think I could actually say those are both kind of my weaknesses as well, because I can be so focused and so dedicated it almost comes off as perfectionism, and that's unrealistic, especially in nursing, and that's just not achievable. And then also with being compassionate and empathetic, sometimes you can cross the line where you're being sympathetic or where you're too tied to a patient, and that can work against you when you're you need to draw the line between professionalism and having personal ties to a patient, especially if it's an acute care or an end of life care situation. And I mean, if you're too tied to a patient, that can affect your care for other patients on your floor, that can affect the rest of your work day, and it can actually cause other problems with patients. So I think it kind of plays both as my strength and my weakness.
So how do you raise the bar for yourself and for others around you?
I think it's always been in my personality to challenge myself. I've always loved a challenge, and actually, if I don't feel like I'm challenged enough, I tend to get bored and kind of slack off. So I've always, even if I am bored in what I'm doing, I've always kind of made myself be challenged. And sometimes it's subconscious. Sometimes I'll just keep going, and then I'll sit back for a second and I'm like, whoa, I'm exhausted. I don't know. So, and I think I do apply that to other people. I think I have high expectations for myself and for others. And so I'd like to say that I help others challenge themselves as well. Yeah.
Okay. What's the greatest challenge that you have experienced on the job?
The greatest challenge, I think, is doing what you need to do without spreading yourself too thin, because it is very demanding when you have multiple patients, and it's very demanding. It's not even just the patients, it's the patients, the doctors, putting in orders, giving meds. It's everything together, and you have to do, you have to get a certain amount of things done, and it can spread yourself thin. You can spread yourself thin if you don't prioritize well, and I think that is one of the most challenging things about nursing, is just figuring out what's important, what's feasible, what's doable, and going from there, and knowing your limits, and being able to ask for help also is a huge thing, because if you're too prideful, if you think that you can handle everything, you can't, and you'll learn that really quickly.
What type of work environment do you prefer?
Like I said earlier, just an environment where you feel like you're a team and like you're going to work together, and if I'm bogged down with a bunch of stuff going on, I can feel comfortable asking someone else to help me out and not feel like a pain or like I'm burdening them, and vice versa. If I'm having a slower day and I can see someone running around with their head cut off, I want to be able to say, hey, what can I do? What do you need help with? And so just being in an environment that has a teamwork, has a team attitude, and communicates well and communicates effectively. I think those are really important qualities to have in a work environment.
Yeah, absolutely. So where do you see yourself in the next 5 years?
I see myself in an ICU setting. As of now, I see myself in an ICU setting in a hospital, and potentially back in school for nurse practitioner school. I'm hoping that it allows me to work part-time at least, but I hope just in 5 years that I know I will have learned a lot, because the learning curve is huge when it comes to nursing, but I just hope to have some experience and to be more, grown as a person, and just to have some experience as a nurse and be able to apply it and grow.
Good. So can you tell me in 30 seconds or less why we should hire you over any other applicants?
I would say I'm a really hard worker. I'm extremely dedicated to nursing in general. I have, I'm a huge advocate for my patients. Not afraid to speak up when I feel like something isn't right or something else needs to be done. I'm a good team member, communicate effectively, and I think I would definitely improve the hospital setting and the floor as a nurse in this hospital. So
great, sounds wonderful. I appreciate it.
yeah, thanks.